I'm Maggie Sackrider. I'm the Director of Program Development and Integration at Oregon Coast Community Action. There are a couple programs, well, there are lots of programs that I'm really excited about. Two in particular I'm going to highlight for you today. Our first one is the Family Assistance and Support Team Program. The reason why I'm specifically selecting this program to discuss, there's a couple elements to it that I think are challenges, particularly to the urban challenges that we've had, or I'm sorry, rural challenges that we've had, but then also it's a program that we work very closely with DHS on. So currently we're leveraging funding. We use SHAP funding for this program, DHS and Meyer Memorial funding. What the program does is we focus on families and children in crisis. So the program is designed not to have a wait list. So instead we realize and recognize that families are in crisis now and they need help now. So that's one of the unique elements, is that it doesn't have a wait list. We also, like I said, work very closely with DHS, which ironically we do really well for this particular program, and I wonder if that has to do with the DHS contract that we have. But like many of you, we also struggle on the flip side working with DHS on some of our other programming, like HSP. So it's a very interesting dynamic with that. I'll say some of the rural challenges that we have with this program are dealing with proximity to services. So we do provide a shelter for these families in particular, and so we've acquired facilities. We actually have a rental agreements for particular facilities, and so we've struggled with where to place those, because a lot of being in a rural community, your selection of location can be very challenging in that you want it to be close to services, but yet the availability of units isn't necessarily close to services. So that's one of the challenges we've had. And then also, that's sort of the meat of that particular program. One of the other programs that we're really proud of is a program, we call it Social Service Connect. This kind of ties into that community capacity building projects. This one, it's an event that we host in our location once a month. And we bring together representatives from cross-section of social services. So that includes DHS folks come to that, but we also have mental health caseworkers that come, our housing authority, veteran services, so really a broad range. I think the key to that program is that we focus on folks on the ground. So the intention is for our caseworkers to network with other direct client staff in, again, that cross-section of agencies. And so that program's been very successful. It's been going on for about 6 months now, and we have 163 individuals attending, and a lot of those individuals attend regularly. So in our small community, that's pretty significant. We've had over 40 individual agencies represented. And I think the key success point for that program is that every time we have a program, I really stress that this is for the case managers. And so they decide what representative from the community they want to hear from at those meetings, and then they get an opportunity to network. So it's a big networking event once a month. So those are the two programs. I do want to just give a quick shout out to, we just hired a landlord recruitment and retention specialist that we're pretty proud of, but we want to learn from you guys. So I don't know if that will come up with any of my other panelists, but if you folks out there have a program, landlord recruitment and retention program, please reach out to Jeremy Matsui, because we want to learn from you on that one.
Me too. I think if any of us arrives at that solution, we'd all be happy. I'm Kelly Wessels. I'm the Chief Operating Officer for United Community Action Network. We cover Josephine and Douglas County. I'm going to talk today a little bit about something that takes a long time to address, and that's part of addressing work culture and delivery of services. And mainly because, and I'm using Josephine County as our example, because we have really made an intentional shift in delivering services to our street homeless. And I think we're seeing some really interesting changes. And we always talk about meeting people where they're at, right? But the clock ticks differently for individuals who live on the street. And yet, as providers and institutions and systems, we are constantly forcing them to adapt to a clock that is not what aids their survival best. I live in a community that prohibits having shelter right now and does not allow for warming centers. And so in that community, I have a growing street homeless population. We grow by about 20 to 25% each year. And our current numbers we're still waiting for authenticating, but we went up to almost 2,000 counted on point in time count day between street and unstably housed. Just to put a little bit more of a view on that number, 52% are under the age of 18. Welcome to Grants Pass, Oregon. So, now that I kind of frame that, these individuals have some real challenges, and our resources are what many are in rural communities. They're challenged. But one of the things that we do is that we have changed how we deliver, and we looked at it from the point of view of, at first it was kind of selfish, to be quite frank. Friday afternoons, inevitably, 4:45, what happens? Okay? And Monday morning, let's also talk about the fact that what does it look like when you drive into work and the lines around the door? That is not healthy for anyone. And to place people in positions where they feel that need of desperation to connect with you said to me that we're not available when people need us. So while we can't change everything about that, what was in our control to change? And one of those was to decide that Fridays we were going to offer and change our programming, so to speak, across all services to focus specifically on homeless population. So it didn't matter what department you were in, it was all hands on deck. We also have created a multi-service center. So we have partners that are available to us all day Friday. We have DHS, St. Vincent de Paul, who does a meal service on site because we know that people need nutrition. And so we opened up our parking lot and we made accommodations so we could have a meal. I need to point out that that meal is not just for those receiving services. It is a meal that can be shared among staff and volunteers and other providers. Because we're also trying to establish a sense of community. Tell me what you need now. Make it so that we frame it so that we can be conversational and relational and build rapport. Because oftentimes in the service industry, we're expecting people to just spill everything within the 15 minutes that we've got them. Does not bode well for relationship. So we have that going on. We have our CCOs and our healthcare providers, all care and primary health come in, because we're really looking at where, if you're gonna put your money where your mouth is and say that health and housing are tied together, then show up and be present and see what it looks like to be homeless on the street and not get your health care addressed. These are the same people you want to be coming into the clinics, but then don't have no accommodation for them. We have treatment providers, we have Maslow Project. We do our outreach, homeless outreach in coordination with Maslow Project. If you're not familiar, they deal predominantly with unaccompanied youth and getting kids that are homeless into school and connected to services. So we deal, while we may deal with the adult portion of the household, they can do what they do best, which is specialize with kids. We have our housing authority on premises, we have WorkSource, and we also have Oregon Law Center because, as some of you may or may not know, we have some federal litigation that's going on in our community regarding criminalization of homelessness. And it has recently become a class action. So we do all these things and we fund it through CSBG, EHA, SHAP. We get some limited funds for supplies and resources from Three Rivers and District 7 schools, actually from their employee funds, which I think is really interesting that their employees back it, and DHS. We deliver the services, we provide a meal, we provide access to clothing, to we will spend time wrapping around people in different combinations. We will talk to people about what they want to do that weekend. How are they going to be safe? The whole intent of doing the services on a Friday like that is so that the crisis level is reduced, so that Monday morning does not seem elevated, and that we actually look at how do people get through a weekend with dignity, rather than feeling like they have to sink further to get our attention. As a culture, that gives us an opportunity as well to really ask ourselves the hard questions. Are we providing what they need or what we think they need? And so listening to their discussions and understanding what it is that they really want us to deliver, not just what we want to go out and buy. So it's been really good for staff. We have an opportunity to have staff work in different levels. Our volunteer pool is different. We run a on-site pantry as well that is specific to homeless food items, and it's a shopping experience, so they can really choose what they need and what they can feasibly use, instead of just handing somebody a box of food and expecting that that's going to function for them. It's really about choice and client-centered choice. Giving up control has been interesting for staff, but it's been really helpful for us because our relationships are better.
Sounds wonderful. And something that could be easily replicated. Not easily.
Yeah.
Not a lot of
Nothing's easy in this
planning,
world.
But kind of doable. Yeah, at least parts of it.
Yep.
That's great. So I'm Gina Dusenberry from Access in Jackson County. And we have two new projects that we're excited about. The first is a community resource desk on the Providence Hospital campus. And so they had approached us, Providence Medical Group. They have 6 sites already in their hospitals where a community agency staffs the person, because they really want to address the social determinants of health, so that as people are at the hospital, they also can access other resources for their other needs. So the staff member is an Access staff member, paid for by Providence. And so, just trying to help people with those needs. So they're referred there's 21 different clinics. And so we've met with the clinic directors and the hospital department staff. So they'll refer people. If someone has been at the emergency room 2 times or more in a year, they're automatically referred to our community resource desk. The clinics can refer anyone who shows interest in that service. They encourage folks, and it could be anybody could come and access that community resource desk. So those referrals come from the clinics and just anybody in the hospital and individuals. We are trying to look at what hours, we just started April 1st, so it's pretty new. But looking at what hours are really going to be helpful for folks in the community, and also how much time our specialists might spend at those clinics. So we'll kind of be working out some of those logistics. So just building the library resources, certainly all of the resources that we have through Access, but also whatever else is out there in the community. She's been trained to be an OHP assister, and we have a couple other staff so that like when she's on vacation or whatever, that we always have someone available to help with that. A unique thing about our community resource desk is that we're working with OHSU researchers. So we've been trained on their, like this database system that the researchers will use. There's a screening for those social determinants of health that will enter in there. She will enter in any services or resources she's able to provide, do a 1-week follow-up and another follow-up in a month, and then just kind of see what other follow-up, the participant might really want and need. So the other one is called the Reentry Program, and it's through Meyer Memorial Trust, their Affordable Housing Initiative program. So the goal is to address barriers to housing for people who have been previously incarcerated. So we have a team of 4 different agencies. So Meyer Memorial really wanted to kind of get a cross section of people that, different demographics that we work with. So Northwest Housing Alternatives, they've really done a lot of work with landlords. They really helped with the initial planning of this project. Urban League of Portland, as they work with a diverse group of folks, people of color, adults without children. They worked on marijuana expungement on people's records. Sponsors Incorporated, they're in Lane County. They have a lot of experience in working with the Department of Corrections and in housing that population. And because Access is rural, we work with veterans. We already have a good relationship with DHS, anyway, as far as working with families who are in community family court. So hopefully that each of us will be able to bring something to this pilot. So the idea is to create a model that will help find what are the minimum strategies and interventions that are most helpful in getting people housed. So how much debt relief can we help provide that will help them get housed, help with previous landlord debt or damages that have happened in the past, fines, legal fees, restitution, and lawsuits they might be involved in, expungement, reducing the crime, what crimes might be able to be reduced to a misdemeanor, that will help, and just what are the other things that we can pay for that are going to help. Would a lease bonus be one of those things that would help? Just trying to really develop whatever is going to help. So really working with landlords and figuring out. So we're going to track the demographics, disabilities, specific convictions, kind of length of incarceration, the type, how many times, what was the age of their first incarceration, just trying to gather as much data as we can to help create this model. So we anticipate about 80 to 100 participants over this next year and a half. And yep. So we're looking at how do we develop that relationship. So some programs I'm sure already have a great relationship with Department of Corrections. In Jackson County, we have the county jail, but we don't have any state or federal prisons, so really developing a system for being able to reach out to those people. We don't know who they are. So meeting soon with the person who's oversees that parole, probation, the work center, how can we reach out to those folks? So, we'll see.
Thanks. I'm Pat Rogers. I manage housing and homeless services at Community Action in Washington County and also the coordinated and centralized system we have set up in Washington County. So I'm mainly going to talk about a brief introduction of the system, the coordinated system, but mainly discuss the lessons we've learned along the way in that regard. So I have some flyers that I brought along that have provided a brief description of how the system works. We can place them on a table somewhere. But basically, the Community Connect system consists of a screening, which is done by phone. We get the word out to homeless persons in a variety of ways, but mainly through the use of this card, which is a bright green card. It's printed in 2 different languages, Spanish and English. And so public safety personnel, fire departments, the libraries, anybody who might have contact with homeless persons have a stack of these that they can distribute. So that's how we get the number out, which is a single number for the screening process that takes place typically by phone. Not only by phone, it can take place in person if necessary. We can go to people, but mainly it's set up to be by phone. The phone is answered not just during business hours, but also on weekends and until staff go to sleep at night at the shelter. So the phone line is at our shelter, and therefore, since the shelter is staffed throughout the 24-hour cycle, there's always somebody there to answer the phone. We have about 20 different agencies participating in what we call our portfolio of housing options that people can be referred to. The people that conduct the assessments after the screening process, so I neglected to describe that beyond the screening, there's an assessment that takes place. So during that screening call, basic demographic information is collected. And then there's an assessment appointment that is established at a later date for the homeless person. That assessment appointment takes place in person. And if all the stars line up and there's capacity on the day of the assessment, that person is referred to one of the agencies in the portfolio. So the agencies in the portfolio all have either HUD funding of some sort. Mainly the agencies besides community action in the portfolio are HUD funded and typically are permanent supportive housing options for folks. Some of the lessons learned are kind of wrapped around all of that. Community action then has a mix of state and HUD funding that we use to assist folks who are homeless or at imminent risk of homelessness. The Community Connect system, since it's countywide, is driven by an oversight committee. Community action is a part of that. We don't lead that committee, but mostly the service providers that are part of the portfolio participate in that oversight committee. What else would I say about that? I'll just move on. Some of the takeaways since we've been in operation as a Community Connect system has been, just in the last couple of years, this huge escalation in the need for emergency rent and eviction prevention assistance. We've been doing a lot of that work. Because of that, we've learned some lessons in that regard that I'll talk about in a few minutes. But mainly, it's a capacity issue. And so when you have a coordinated centralized system, if you have the front door wide open, but you don't have the capacity to serve everybody that you're inviting into this store, sooner or later you have people still coming into the store, but there's nothing on the shelves, that day. So it's becomes an aggravating experience for the homeless person. We did some math one day. We were going over our phone records, and we have a system that we can track all the call volume that comes into our agency. And we were sitting in a meeting one day and looking at the call volume. mainly to a specific phone number that deals with emergency rent assistance and eviction prevention. And what we've realized by doing a little simple math was if we were to throw like the typical average bailout or stop the bleeding type rent assistance at a household who was threatened with eviction, say $1,100, and we served every unduplicated call that came into our agency, it would take $6 million for a year to serve everybody that called. So that kind of gives you some perspective of the scale of need out there versus our capacity to really do anything about it. So that was kind of a wake-up call. Some of the lessons learned, since we're community action, but we're also managing the daily operations of the centralized system, which is a county-wide system and a county-driven system, continuum of care-driven system. There's a lot of confusion for clients around coming to community action buildings, but participating in a centralized system that's not community action. So it becomes very confusing for folks. What they believe that their community connect or centralized system appointment is a community action housing assistance appointment, and that hasn't taken place yet. So finding a way to separate community action agency from the county-based system is something we're grappling with right now. We have a one-size-all type of assessment. So whether it's eviction prevention or the assessment is a rapid rehousing assessment, the assessment is one size fits all. We've realized, and I've been pushing for a while, to have a separate assessment process for the prevention work, which is sometimes a transaction that doesn't need to go into, a person doesn't need to sit through a lengthy assessment that can take up to 45 minutes just to get the bleeding stopped on their housing situation. So having that experience be relevant to the type of service somebody's seeking is something that we're having to take a look at. Additionally, I think the lengthy time commitment of the rapid rehousing assessment needs to be looked at. It's a score-driven assessment and referral process, so basically a score accumulates throughout the assessment, and that drives or informs the appropriate placement in our original thinking. That's proving to be not working so well, and we need to take a look at prioritization criteria that goes beyond just the score-based referral process. We also need to take a look at maybe phasing in the experience of the assessment to where the assessment itself accumulates as a person progresses through the process, because there's such a time commitment at the beginning of the process, and sometimes people don't get referred to a program. That becomes an aggravating experience for folks who have put in like 45 minutes of their time, shown up at a certain period of time for their assessment, and then at the end of disclosing all this information, they find out there's no placement for them. So that's definitely something we need to focus on. I feel like I might be taking too much time, so I'll kind of skip forward and answer questions later. But I think at an oversight level, our focus at the beginning was, we kind of did a happy dance that we put a system together, but we really didn't have this humble way of looking at ourselves over time and hearing feedback from people. Like when you have a bunch of folks out there and you try to hand them this card, say during the point in time count, and they take the card and throw it back at you and said, yeah, I tried that. That was a bunch of BS. That's feedback, and that tells you that the system isn't working in a way that feels gratifying or results-based for folks that are trying to access it. So using that feedback, we should be introspective and willing to make progressive changes over time as we discover what is or isn't working. We haven't been willing to do that. So at the beginning, our focus was primarily on our output and data, how many people came into the system, but not really anything based upon feedback from clients that are accessing the system. And as far as implementation, it took us over a year to come up with the system in its original form. We're still functioning with the system in its original form. Right now, we're in the middle of discussions on transforming the system, dividing, the assessment, looking at dynamic prioritization as a method of bringing people, the most vulnerable folks, going beyond BI-SPDAT as a tool for that, but finding out what dynamic prioritization would look like in our county. Another problem we had was with our permanent supportive housing. So beyond what we have at Community Action, the only other thing out there is the Shelter Plus Care permanent supportive housing programs. We have most of the agencies that are capable of providing the ongoing service match for that program are mental health service providers. So if you're trying to establish a system-based housing first method of dealing with the issue of homelessness, it becomes exacerbated when the referral for permanent supportive housing from our community-based or coordinated system turns into this assessment for mental health services rather than a housing placement. So when I saw the Housing First presentation yesterday, that guy made the point, you have to separate treatment programs from housing in a Housing First system, and we aren't doing that, and we haven't done it yet. I think additionally, there's a lack of ability to commit to the ongoing service match for situations in Shelter Plus Care that aren't mental health issues, that are physical disabilities or that sort of thing. And there are no agencies in our county that are capable, other than us every once in a while, of committing to that ongoing service match. So that leaves a whole bunch of people out there that are unable to access permanent supportive housing in Washington County, especially Shelter Plus Care, because of that issue. I'll turn it over to Erica.
Well, what a great bunch of projects and programs. So my name's Erica Silver, and I'm a program manager within Clackamas County Social Services. We're the community action agency for Clackamas County, and we also run the coordinated entry system. We've had a fully functional coordinated entry system since January of 2015, and we rolled in all of our populations into one, and we also worked really closely with our domestic violence provider to make sure that everything was as integrated as it could be with that. But that having been said, we definitely face the same issue that Patrick was just talking about, of so many people coming in, and then it kind of just gets to kind of a roadblock because there's not enough services on the other end. And so this past July 1st, we decided to roll in our prevention and diversion in a much more meaningful way through some contracts with other providers. But we also, I'm a big fan of the national conferences because you always learn something, and even if it's something that someone was doing in LA or Chicago, and my first reaction is like, oh, what's big old Chicago gonna have to do with little old Clackamas County? But there's always something that you can get. And so somebody had gone to a conference, it wasn't me, and they brought back a bunch of stuff from this place called the Cleveland Mediation Center. And they are a interesting organization because they're kind of like a division or a department of a bigger agency called Frontline Services, which does a whole lot of homeless housing, and they also do mental health services, and they also do, I think, child abuse assessments, kind of like, I don't know if anyone here knows what CARES is in Portland, but they kind of do that. And they also have mediation. And so when this whole thing about diversion started coming up, the Cleveland Mediation Center realized they were kind of in a unique position to take this on, because a lot of what diversion in their mind, what they thought was a lot to do with conflict resolution. And I'm trying to go paperless here, so I'm not really just looking at my phone. Okay, there it is. I have. So they developed this whole training around, like they call it a deep dive into system diversion. And so we decided, like Patrick had just alluded to, like there was never going to be enough money in the world, or maybe that's an exaggeration, I guess we could change our priorities, but there was never going to be enough money in our system that we could see anytime soon to be able to like solve what everybody was asking for with money. And so we clearly needed some other tools. And so system diversion, everybody kind of thought, yeah, I'm doing it, and we're asking people a few questions to see if there's any friends or family that they could stay with, or things like that. But we hadn't really given ourselves a way, we didn't have a framework to taking a deep dive into what does that really mean when we say system diversion. So when the EHA Innovation Fund came out this past whenever it was, a couple months back, came out, I decided to contact Cleveland, see how much it would be for them to come out and do this training with us, and then also connect with our local mediation center, which is called Resolution Services, and see if they would come on board to the project. And so they were really interested in this, which I was thankful for, because they bring a little different perspective. And so what Cleveland did, so it was $27,000 for both of those two things. And so I was like, oh, easy peasy. I'll apply to the state, and they'll be like, yeah, $27,000, that's not even that much money. Sure, we'll give you that money. And they did. So we just had the training back in like a month ago, back in March. And it's a 2-day training, and there was 4 mediators that from Resolution Services that participated in. First of all, there's a 2-day training, and it really does like a lot of stuff to really help to reinforce what is diversion, what does that really mean, how can you bring this conflict resolution, and really listening to people and really reflecting back and trying to help them to get out of their kind of crisis brain, I guess would be the way to say it, and because obviously they're the experts on their own situation, we're not, And so it was a really useful 2 days, I'll read off some stuff from the agenda. Diversion is conflict resolution, impact of conflict and crisis, reversing the downward spiral, role of diversion in ending homelessness, coordinated assessment and diversion, the National Alliance Principles for Homeless Prevention, obviously listening, and then let me get to my other picture here, because then the second day was a lot more kind of role playing, where we went into like the diversion steps, a lot of demonstrations. There was some videos the first day, and they were kind of mostly showing diversion like in a shelter setting, like at the front door to the shelter, or within a couple of days, having that diversion conversation with people. But we were able to get enough from that to apply it, like even though in our community we have hardly any shelter, virtually none. Diversion demonstrations, diversion outcomes, troubleshooting, reality testing. It was really cool. And so there was like 30 people that came to the first 2 days. There was about 11 different organizations represented. We made sure to reach out to the culturally specific providers, so OHDC and IRCO, and as well as Catholic Charities that does a lot of work within the Latino community, all came and participated in it, even though not everybody had HUD funded or even well, mostly everybody had state funded, not everybody. Even like a law enforcement officer that's a homeless liaison, he came to it. And they all came back the second day, so that was good. And then the third day was a smaller group, and so that was a train the trainers. So the way that Cleveland does it, you can, like, once they come out and they train you, then they give you the materials, and then you're empowered to train your wider community. So we haven't actually done any trainings yet, but like one cool story, because again, like there's never gonna be enough money. And the way that our system is set up is we call it the front end and the back end of the system, and we call it the highway to housing. And so on the highway to housing, we think of it as like there's a bunch of exit ramps. And one exit ramp might be the veterans document recording fee, and that can help veterans with moving costs or prevention. But if they're not a veteran, they can't use that exit ramp. One exit ramp would be the elder's rent assistance. But if they're not an elder, they can't use that. So every different exit ramp, and there's times where all of the exit ramps are closed because everybody's already at capacity, or you know, they had a staff change and they don't even have anybody to do it right now. So one story that I will share, so we're trying to exit ramp as many people, and before they get to those homeless housing programs that are essentially, unfortunately, waitlist. And waitlist are not what a homeless person or a homeless family needs or wants. They want housing. So there was one, here's an example that I thought was really cool. So our coordinated access coordinator, I think that's her title, was talking with someone, and all the exit ramps were closed. And she basically said to her, like, knowing that there's not any money right now available to help you solve this crisis, what else do you think might help? And so then she was just quiet and just waited. And then what the person said was, she said, I really need somebody to sit down with me and help me look at my budget and just help me figure it out. Because really, I think that I almost have enough money, but I don't, just that confusion. And so, so Lauren, she said, okay, you want to come into the office? She said, I can't because I just started a new job. And I can't take time off, it's too long to travel there. So Lauren said, well, how about I come out to where you are, I'll meet you on your lunch break and we can sit and we can look at it. And so she did that. She went to her, they looked at the budget, and the woman was able to find a way to prevent her and her family from becoming homeless just through that. And so I love that example because it just shows how listening to people and helping them to think outside of the box can sometimes really work. The obvious examples are like, do you have a friend or family out of the area and maybe you just need help with transportation getting there? Some people have that, a lot of people don't. Another example is, well, are you living with somebody and they're saying that, it's costing too much because like the water bill or the heating, or you're eating them out of house and home because you have 4 kids, and what if we put a little money to help them? And again, like sometimes, yeah, that is what it is, but it could be any number of different things. And so we just started this. I don't have any data on it, but we're pretty excited about it. And I would definitely recommend, if other continuums are interested in this kind of training. I felt like the price was really reasonable, and the information and the way that it was presented. They've presented it to over 30 COCs around the country, and I felt like it was really good. It was a good use of everybody's time.
All right, so this was my favorite part of the entire convening. These guys right here, all of you, this is what it's about. So with this, we've got 10 minutes do you have any questions that you would like to ask our panelists here about their programs?
I can't remember which one of you said the words lease bonus. What is that?
All right. Yeah. So just exploring with landlords what, because this Meyer Memorial Trust money isn't tied to like how much we can pay, double a deposit or whatever. Just what it might take to have a landlord be open to housing someone who's been previously incarcerated that they, in the past or without that, may not be willing to do. So it's just just really trying to look outside the box and what's going to happen. I mean, I know there's the rent guarantee program too, but the person has to have gone through ready to rent. So, yeah.
Thank you.
What options?
Any other questions? Just over afternoon.
So I want to ask though, if any of you have had some successful strategies that have worked with folks who have been previously incarcerated, please share them with me. That'd be great.
And I'm also curious, is your team going to be able to come out and train the rest of us?
Yeah.
On what you learned? I mean, does anybody want that?
Yeah.
I'm thinking I would.
That's coming to you.
Oh, the.
Yeah. So Cleveland, specifically in like the agreement that we had to sign with them, it gives us the license kind of to train people in our own local community, but not outside of that. So they really, I think, want to encourage communities to increase their own capacity kind of. So, yeah.
So.
But the
we
state
don't
might
really
be able
have it.
to.
Yeah.
The state might be
Would
able
you
to.
recommend this to the rest of us? I mean, this
I really would recommend it, yeah.
I wrote it down.
Okay, can we just get a quick show of hands then of who might be interested? We might be able to just look at the upcoming biennium and what our training and technical assistance plan looks like. And we know there's going to be some shifting around with how we're using discretionary funds and the innovation funds. And actually, we didn't use all of our innovation funds this year. So we'll have to do a little exploring, but if that's something that you guys would like for us to pursue, we'd be happy to do that.
Okay, so maybe we have used that money. We'll find it. This is what this is about too, right? Finding, you letting us know what kind of training that we can help get to you guys so that you can do all of these wonderful things, all of the wonderful things that you guys are doing too. Any other questions? Any other comments from the panelists? Well, I do want to thank you all for your time, for answering the questions. Pat, you were really good at answering all of the questions that I gave you in that email. Thank you. Appreciate it. And we're going to go ahead and just take a couple minute break here so that